PPACA is trying to bring that to American people nationwide.
Okay, good enough. Okay.
Okay.
Thank you, Pete.
I guess I don't want to confuse anyone, but I want to be very clear about my position personally. I am for healthcare reform. I am not for PPACA. So I don't disagree that there are a lot of problems that the market-based system has not dealt with very well. That being said, it's regulated across all 50 states by different commissioners of those states. Wisconsin actually has fared better than some other states across the country in terms of uninsured. That was one of the key things or drivers that got us healthcare reform is the number of uninsured. I think if you look in the southwest of the United States where you've got 30% uninsured, it's a different flavor out there. Wisconsin has historically in the last decade been in the 6 to 8 to 9% uninsured. And when we say uninsured, we kind of have to clarify those, that 6 to 9% is not all made up of people who can't get an insurance policy. Some of those are by choice. And now even with the individual mandate that's part of PPACA, where everyone is supposed to have insurance coverage beginning in January 2014, there will still be many who will pay the penalty and not have the insurance coverage, which poses a dilemma for the insurers because that means someone is not in the pool and it's going to raise the cost of the pool. So I don't want to get into some of those mechanics, but the reason I'm not for PPACA is this. While I do believe we need health care reform, and I wouldn't support repealing it without having some idea of what are you going to do with it, I feel that the two key drivers that got this country PPACA were escalating costs. Costs that are going up at 3 to 4 times the normal inflation rate, and the number of uninsured. So when you look at the CBO, the Congressional Budget Office's own estimates, the actuary of CMS, Richard Foster, put out a report that was published in April, a month after PPACA was passed, was legislated. The report was available in November, but it wasn't released until then. It's something Congress should have had. It's something we all should have had. I mean, I applaud what Bill has done here. The problem is we weren't doing this two plus years ago. But by the CBO's own measurement, PPACA will cost $311 billion over the 10-year period than doing nothing. And we will still have 23 million uninsured in 2019. So when I look at why we have PPACA and what the expected results are, I'm saying this is going to fail us. I think there's people that have expectations that are not going to be met. And I do believe we have some serious issues in healthcare and healthcare costs, but this is not the answer.
Mike.
Well, thank you all for being here, and thanks Bill and Greenfield Library for inviting me. So I now summarize what Pete said, correct? Okay. So Pete is for a health care reform, but not this particular reform. And the problems that exist is that the problems that exist are ones that the market has not addressed. We agree with Robert on that. But Wisconsin has fared better in terms of the uninsured rate. Under the mandate, some will continue to pay and choose to be uninsured. You think we should repeal it, but no, you think we should repeal it if we have an answer that would replace it. And then you mentioned the cost of and what CBO has projected. And the main point is that this reform will be costly and many will remain uninsured. Right?
Correct.
Well, I have sort of challenged that it's refreshing to hear someone who's against the law say that it should only be repealed if we know what it would be replaced with. And I would sort of challenge your side to tell us what that could be here in Wisconsin. And I know I've also heard Representative Stone in an interview with Mike Boucher and a debate with John Richards, and you said, Representative Stone, that there could be a better answer than what the ACA did. That's paraphrased, not exact words, but I want to know what that would be, because we haven't heard that from your side. It would also be good, I think, to recognize that the law wasn't just done because of costs and those who are uninsured. It was done because the insurance companies were discriminating against people. Medicare costs are out of control. Medicaid costs are out of control. States can't afford this anymore. There's many more things in the bill in terms of infrastructure investment, workforce expansion, health centers at schools. There's many, many good things that this community and every community would benefit from. And I think it's refreshing that this community is hosting this debate. And I wish we were going to every library in Wisconsin and doing this and talking to everybody out there who has these same questions, the same uncertainties and sort of anxiety, though probably it's really not warranted anxiety about this bill. I think Robert did a great job describing what the bill would do and the benefits of the bill. And we just need more people to understand what those are and how they will impact everybody.
I'll tell you, Bill, I thank you for putting this together. I've done a number of debates and being in public service for 18, 19 years now. And this one makes you work a lot harder than most. I'm having a hard time just keeping the notes because I want to use this format to its most valuable limit, which I think is for us to understand what the opponents are saying and to come to grips with that. And so I appreciate the opportunity to do that. And in listening to Mike, you know, one of your questions that you had was what could, you know, the reform be that he did mention as far as if you weren't going to do the Affordable Care Act. And you believe that this was done because insurance companies were discriminating, that there are other issues that states couldn't afford to continue on the path that we were on as far as how they were handling health care. And you don't think that the anxiety about this program is really warranted. So I guess what I would say is that I believe that we have seen the beginnings of reform, and Wisconsin has always been a leader in reforming over the last few decades. It's one of the reasons I got involved in government at a state level. We had done a lot of reforms around the area of education. We've done reforms around the areas of welfare. And I think that Wisconsin, once again, is leading the nation in healthcare reform. And we've seen it particularly, not so much in the provider, insurance provider area, but in some of our businesses. Quad Graphics is a good example. They've taken how they handle healthcare within their company and done it in a new way. It still uses some elements of traditional health insurance, but they're very proactive in promoting health and wellness among their employees. If you ever walk into the Quad Graphics plant in West Allis, you go through the front door and to your right is a pharmacy and a gym or an exercise area. To your left is a doctor's office and a optical department, and upstairs there's a full dental department. You feel like you walked into a healthcare facility and you walked into a printing plant. So, you know, obviously we're getting some amazing innovation. It's one of the most unique places in the country, and that's being copied by other major employers in our area. Now what's happening is they're getting healthier employees and they're driving down the costs. And so I think that we are innovating, and the market is changing. And I think that what you're seeing now is both providers and insurers in Wisconsin are working on new ways to say, how can we do a better job of using this large portion of our budget, you know, whether it's personal or government, on healthcare.